Both diabetes and mental illness is a big global burden, and we also know that the prevalence of mental health issues including depression is pretty high in patients with diabetes. However, no study till date has evaluated the temporal changes in the pattern of prevalence and incidence of depression, use of antidepressants in overall any mental illness at the time of diagnosis of diabetes. So it's in newly diagnosed type 2 diabetes people. So what we have done is using nationally representative patient level electronic medical records from USA, which is in the current date is about 46 million patients, and the primary care electronic medical records, arguably the world's largest EMR from primary care system in United Kingdom. We have evaluated the prevalence and the temporal changes in the prevalence of clinical diagnosis of depression, any mental illness, and also the prevalence of the use of antidepressants with or without clinical diagnosis of depression at the time of diagnosis of diabetes from 2000 till 2016 or something. In what we have observed, that especially in United Kingdom, starting from around 15% prevalence of clinical diagnosis of depression and use of antidepressants, irrespective of having or not having a clinical diagnosis of depression, there is an exponential rise in the prevalence from 15% to up to about 35%. And this is really striking over last decade. And the proportion of people who are taking antidepressants of any kind is indeed exponentially increasing without the clinical diagnosis of any depression, exponentially for both countries, UK as well as USA. This is striking. What we have also observed that the prevalence of depression and as well as the incidence rate of depression in patients with new diagnosis of diabetes is 1.5 to 2 times higher in women compared to men. And if you look at the whole spectrum of last decade, the incidence of depression, irrespective of whether you're having a clinical diagnosis of depression or using antidepressants without a clinical diagnosis of depression, the risk is significantly high from 24 to 45% over the whole spectrum of the last decade in younger people, especially those who are below the age of 50 compared to the older people. Indeed, the use of antidepressants has exponentially increased in both countries among people who are young, within the age of 30 or 40 from 18 at the time of diagnosis of diabetes. And it is also true at the same time that the incidence of young onset diabetes is also significantly increasing over the period of time. So this is very striking, and what this clinically means, and also at the public health level, it means is that we need to have a proactive and very focused policy of evaluating mental health issues in people with metabolic diseases, especially in people with diabetes and cardiovascular diseases.